Good morning, Ceann Comhairle, and can I also congratulate Deputies Daly, Wallace, Fitzgerald and Kelleher on their election to the European Parliament. Taoiseach, this is National Carers Week. And it's a week in which we acknowledge and recognise the tens of thousands of carers throughout the state for the contribution they make to people's lives, to family and to communities. I think we can safely say that they are everyday heroes without whom many people would not enjoy a decent or a normal life. And I am sure that we can all agree that they are to be commended for their effort and their work. So it's with much regret, therefore, Taoiseach, to learn, as we have recently, that the HSE has now effectively suspended the allocation of home help hours to new applicants. And they have moved this suspension at a time when more than 6,000 people are waiting for access to home care supports. You know as well as I do, Taoiseach, the impact that this is going to have on older people, people in need of care, or on people with a disability and their carers, as well as the wider community. You know also that it will place further pressure on hospitals by compounding the problem of delayed discharges. The HSE say that they have taken this action in order to balance the budget for 2019, but the reality is that curtailing home help hours is really a false economy. Home help, in particular directly employed home help, represents exceptional value for money and allows older people to remain in their homes or to be safely discharged from hospital. So without enough home help hours, patients are forced to remain in hospital at a huge cost to the HSE, or else families are forced to pay privately for home care support. And neither of these represents value for money and ends up costing more in the long run. We consistently hear from patients in hospitals who can't be discharged because of a lack of home care supports. There are people who want to go home and who could go home, who should be going home, provided that there are adequate supports in place. But this isn't the case. Despite a budget increase of 10 million for this year, the number of hours being provided is simply not enough. Now, I could, Ceann Comhairle, say we told you so, because Sinn Féin warned that the allocation would be inadequate. We had argued for an extra allocation of €40 million in respect of home care packages to make adequate provision, but you chose not to listen. So what I would like you now to do is to commit to looking at whether funding can be found in the HSE budget to fund additional home help hours that can ease budgetary pressures elsewhere, and I would ask you to do that quickly, because that would be money very well spent, Taoiseach. It would save the HSE money in the long run, and at a time when there is rightly a focus on budgetary practices, we need to be focused on things that work and on real prudent public spending.
Thank you, Taoiseach.
Thanks very much, Deputy. And it is indeed National Carers Week, and I want to join with the Deputy and others in this House in joining my voice to those who pay tribute to carers, to those who do enormous work for their families and for others, caring for people in their own homes, in other homes, and the government and society values that work and values it enormously. And those aren't just words. In the last couple of years, government has done or made some substantial changes to improve supports that exist for carers. For example, the Carer Support Grant, which had been cut, has been fully restored, is being paid at the moment, and indeed there is no means test for that. We've increased carers allowance and carers benefit by €15 a week over the course of the last 3 budgets, and the means test for the carers allowance is considered to be one of the fairest and one of the most generous in the developed world. We also extended free GP care to people in receipt of carers allowance and carers benefit last year, because we believe that carers need to be cared for too, and now they can attend their doctor without having to pay a consultation fee. And there's also been an increase in provision for respite, about 12 new respite houses being opened across the country to provide more respite for people so that carers can take a break too. And I think that's really important for their own physical and mental health. In relation to home support and home care, just to restate that there hasn't been any cut in funding for home support. In 2018, the total budget was 418 million and 15.7 million home support hours were provided, and that includes intensive home care packages. And in 2019, almost 30 million extra was provided in the budget, and that allows us to increase the number of home help hours being provided this year from 17.5 million to 18.5 million, so nearly an extra million hours being provided this year, which is quite a substantial increase. But as is always the case when it comes to health and social care, there is no limit to demand, and we have to manage within our means, and we have to make sure that we come in on budget and that we provide for that appropriately.
McDonald.
Thank you, Ceann Comhairle, but you see, you haven't addressed the central point of my question, which is the fact, and it has been confirmed by the HSE, that between now and early November, that there will be a reduction, a restriction of the number of new or additional hours allocated. And as I said in the course of my question, this comes at a time when over 6,000 people are on a waiting list for home care supports. And very often, Taoiseach, as you know, those will be the only supports afforded to carers. So I've asked you a very simple question. You've recited what you regard as your record of support for carers. Carers, of course, would dispute that in many aspects of it, but I'm asking you about this particular issue. And I want to know, will you go back to the HSE and will you say to them that it's not acceptable to say to people who are waiting for home help hours that they may not receive any assistance until November? I mean, that's months away. And anybody who has charge of the care of an older person or a person with a disability will tell you that it's not sustainable to ask them to wait for months on end for those additional supports. The HSE have said they're taking this action because of budgetary pressures. I've made the point to you, Taoiseach, that in fact that is a classic case of penny wise and pound foolish. A cut of this nature runs against the grain of sláinte care and the stated intention to keep people in the community. It runs against the ambition of dealing with delayed discharges and overcrowding in our hospitals. So it makes eminent sense for you as head of government to go back to the HSE and to say to them that the money has to be found, that 6,000 people and more cannot be left in the lurch, and particularly now in this week, as it is National Carers Week. Can I ask you, Taoiseach, to make that commitment to the people that you have commended so warmly? Tell them that you will go back to the HSE and that the money will be found for home help hours.
Thanks, Deputy. I think if it's a case of comparing records, one only has to look at the difference north of the border when it comes to the income supports provided to carers, where your own party served in government for a very long time. I'm very happy to compare that record at any point in time. In relation to home help and home support, the budget for home help and home support in 2015 was 306 million. This year it's 446 million. So in the course of only 4 years, there has been a 50% increase in the budget for home help. Now, I know people will argue that providing extra money for home help takes pressure off hospitals and reduces hospital costs, but there is no evidence that that actually turns out to be the case, because notwithstanding a 50% increase in home help funding in the past 4 years, we haven't seen savings arise further up the line in hospitals, unfortunately. So what appears to be logical doesn't often turn out to be the case when you actually do it. But there is an extra 30 million provided for home help this year. And that will provide an extra 800,000 home help hours this year. 800,000 more home help hours this year than existed last year.
Thank you,
and it is necessary for the HSE to manage that additional resource appropriately.
Deputy Breeds.